right, we will go ahead and start. We're thrilled to have you join the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting will feature three dynamic speakers representing different organizations who will share the resources they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of every month at 12 p.m. So please continue to join us as they occur throughout the year and feature new agencies with each meeting. The Zoom link will remain the same for each meeting this calendar year. Each agency will have about 15 minutes to share about services and referrals, followed by 5 minutes for any questions our attendees may have. We ask that all participants remain muted during the presentations. When we open for Q&A, you can unmute to ask your questions, or you may type it in the chat and one of us will ask it. Without further delay, I'm excited to introduce the two agencies for today. We had one reschedule. We have New Season and Central Alabama Wellness. So we will go ahead and start with New Season. You can take it away.
All right, thank you, Leah. Let me get my screen up here. All right, is that showing for you, Leah?
Yes, we can see it.
Okay, let me get back. There we go. All right, good afternoon, everybody. I will admit, I travel across time zones, so I had to double check with Leah and make sure I was signing on at the right time. But my name is Daryl Lee. I'm with New Season Treatment Centers. Little background on me. I nursed in Alabama for about 17 years. Part of that with New Season, part of that in correctional and other in the hospitals. But since being with New Season, I have, as far as being a lead nurse at one of the facilities, moved into pharmacy auditing and then into program director. And now I'm in community liaison. So my joke is with my boss, I'm not sure if they really like what I do or they're trying to find a place where they like me working. So, but it gives me an insight that some of the other liaisons don't, because I've worked not only in the compliance side, but from the medical side too. But just to get started, at New Season, our mission statement is to triumph over opiate addiction by integrating treatment, counseling, and compassionate patient care. And we want to be a trusted national leader. But more than that, we want to be trusted in each community that we're in, number one. We are licensed, registered, and approved by all of these agencies, SAMHSA, DEA, our state board of pharmacies. We work closely with our SOTAs in each state that we're in. We have been treating opioid addiction for 30 years. We're currently in 20 states. We have, it says over 80 on this slide, but just update, we're at 87 clinics right now. I am the liaison for Mississippi, Alabama, Georgia, South Carolina, and Kentucky. And when I prepared this, we had one mobile unit, and that was in Portland. I've just gotten word that we've got 3 more mobile units coming. I'm waiting to hear what states they would be working out of. The mobile units to hit the areas that patients have trouble getting to our clinics for. Transportation, financial is a big part of the barriers in place of treatment. So while we were working with our grants department on trying to get as much funding, we accept Medicare, Medicaid, a lot of third-party insurances, and we have self-pay, but transportation was still a big issue. So we started, it was last November with the first unit out of Portland. Like I say, we have 3 more coming, but they are able to go out to those areas, and they have 2 windows, and they're able to dose, and they're able to see patients. And there's even telehealth services and counseling off those mobile units. As far as our centers in Alabama, we have 5 centers in Alabama. There's the Huntsville Treatment Center, Tri-County Metro, which is on the outside of Birmingham around Trussville. We have Birmingham Metro, which is downtown on 4th Avenue. We have Montgomery out on East Shirley Lane, and Mobile on Dolphin Island Parkway.
Hey, Daryl, do you have any
Yes.
of the mobile transportation in Alabama from the van yet?
Not yet. Not yet. So I'm waiting to get the update on where that's going to be at. And so it's something that's growing, but just starting last November, it's just having to come in. And of course, it has to meet the requirements and be approved by each SOTA of each state. So
Right, right.
yeah, so I'm expecting to know where they're going in the next couple of months, but I do not at this time.
Right. Okay.
So my whole goal, and when they hired me in this position, I told them straight out, I said, I'm not a huge numbers guy. I don't want to be crunching numbers, looking at spreadsheets and seem like I'm getting caught up in the number of referrals. And my boss, who's now the guy interviewing me, who's now my boss, said the only number he wanted me concerned with was making sure that not only are we connected within each community, but also our clinic staff knows every resource available so that we make sure everyone that walks to our door, if we can't treat them for whatever reason at our program, that we're able to find them the treatment that fits them. And that was easy to get behind every day. Just going on down from senior VPs, we have regional directors and a national medical doctor that filters down to our program director and our medical doctor on site. And he has his nursing team. And then there's the counseling team, pharmacist, and our treatment service coordinator. As far as the clinic site specific, that's just going to look more like the program director and medical doctor, your TSC over your counselors, and your pharmacist and your nursing team. And it's just depending on the size of the clinic. I've worked at clinics where some was able to handle the flow with 2 and some had 4 to 5. So we just try to make sure that we have enough staff there that allows people to receive their treatment and go to work, get their kids to school, because we are outpatient. MAT treatment is not just the medication alone. It is the combination of the medicine and the behavioral counseling. As I've watched patients go through the programs, it is, of course, the medication is important as dealing with their withdrawals and their cravings, but the ground that they gained with their counselor is, you can't put a value on that. We want realistic expectations of patients in treatment, and we want to be able to show measurable outcomes. We work under the harm reduction module. So, we realize somebody coming into treatment after the first day, they're trying to get to where they need to be. The doctor's going to be working with them on adjusting medication. The counselor's going to be working with them on making sure they're building coping skills and building a support system around themselves. And we do individual and group therapy with our patients. We also want measurable outcomes for the community. We want people to know who we are and what we do. We want people to get to know why this program works, and we want to improve health stats through reduced transmitted diseases. We want to cut costs by being preventative instead of reactive to addiction. As far as some results, we did surveys of our patients, and I think this went from 2019 to 2021. We saw from intake where 59.2% were actively employed after 3 years in treatment. That is up to 83.1%. You see involved in criminal activity, and with the law enforcement agencies went down from 16.7 to 2.2. And on the right side, you see non-prescribed use going down. The reason we do 3 years is with treatment, there's not a set time. I've had people, and the best way to explain it, when I was nursing, I did an annual exam for one of our patients, and he told me he didn't feel successful, that he saw people come in and within 2 to 3 years, they had titrated off their medication and were out and doing well. And he had been there for 9 years. And I asked him, I said, well, tell me the difference. I said, addiction and recovery is different. I said, so tell me your story before you started treatment. And he told me, and he was 68 at the time, he told me he had either been on heroin or methadone since he was 14. And it was a family thing, the whole family, he learned at home. And I said, what about after treatment? He said, well, on my treatment and with my counselor, he said, I have a job and I'm home with my family each night. And I said, and looking at this chart, you've also been illicit free for 6.5 years. So his story, every time he tried to start titrating down, and I talked to his medical doctor about 4 months ago, and he still keeps trying to titrate down. They work with him. His cravings come back, and he has to stop his titration. The success part of that is at none of the times when his cravings come back did he go to illicit use. He came back to his treatment. Also, within the emergency medical services within the ER, we saw that 16% of our intake patients had visited the ER for an issue related to their addiction within the past 30 days. You can see that at 3 months and 6 months went down to 4. At 9 months, it jumped back up to 6. I don't know if that 9th month hit around a holiday or for a specific reason that jumped back up, but there was a slight uptick. And then 1 year, 2 year down to 4. And then at 3 years, you see 2% of these patients in the ER for their addiction. And that's important for us to be able to keep people in treatment, keep ER beds open, and keep those emergency departments flowing as they should. And we want to partner together for positive results. We want to create momentum in the community that betters everyone. This I put in here because as I've gone around, I've seen not only community partners that have to work through some stigma and some language, but I've also seen people in the medical profession that have to work through this. And when you ask them what an addict is, and that's one of the things I do, these are a range of the unfavorable answers, in my opinion, that we got. Choosing to use, addicts are uneducated, they're swapping one drug for another, manipulative, morally lacking, and criminals. So we're working on education out in the community too. I've heard, these terms within the medical field: dirty drug screen, lazy, helpless, addict, mentally ill, resistant. And what we're trying to work towards is that everybody sees the difference when we use just a different term. They're a person suffering with an addiction. They're not resistant to treatment. They may not be open to it at the time, but we have to remain open and welcoming for them to want to come to treatment. It's not a dirty drug screen. It's positive. I also heard somebody use a failed drug screen and saw a patient absolutely just, it looked like it crushed her because she said, I didn't know I'd failed in my treatment. So we have to use words, not lazy, ambivalent, and not helpless, unaware of their capabilities. And these are terms, this is an important swing, I feel, as we educate people. We're giving our patients the best treatment we can, and we're also always working, making sure we've got the right people in place, but also within the community too. Because in the community, you all know we're fighting fentanyl at an alarming rate that's climbing in a lot of areas. And in a lot of areas, fentanyl is so cheap out on the street, it's hard to combat that as well. So we get this out in the community. We make sure EMTs, law enforcement agencies have these. Also, one of my states in Georgia, we were able to get some harm reduction vending machines out to help distribute Narcan free to the community 24/7. And we're working on that in other areas. Along with fentanyl, we're starting to see xylazine across the nation, and we get out education for that as well. But in building our community, I just wanted to share something that's close to my heart. I always feel it speaks volumes if we take this to heart. It takes a village to raise a child is a proverb that explains how an entire community of people must provide for and interact positively with children for those children to experience and grow in a safe and healthy environment. It takes a village to help those suffering with addiction holds the same truth. We need every member of our communities helping provide services for and or interacting positively with those suffering with addiction in order to help them heal and recover in a safe environment. Of course, people can always call our clinics in Alabama specifically to them. Our hours are different, usually from 4:30 in the morning to 1:30 or 2 in the afternoon. So I always tell people we have our 24/7 referral helpline that can go through all the verification processes, can jot down the information for insurance, or if it's self-pay, give the rates, and also set them up with an intake appointment for the next available day. And I've also asked, when I was program director, I asked some patients to just tell me what they feel about if they wanted somebody to know that was trying to think about getting treatment somewhere. And I wanted them to complete this sentence. There's no better time than today for, and these are my 3 favorite answers. One individual is the first step to recovery. The next one was never a better time than today for healing to begin. And then there's no better time than today for hope to light up the dark. So we're available. I'm always available for any meets, any questions. I cannot promise I will always know the answer, but I can promise it'll be a learning moment for both of us, and I will find the answer, and we can make sure we find each individual treatment that fits them best. Thank y'all.
Thank you, Daryl. So if anyone has any questions, they can either ask them now or put them in the chat, either or. All right, no questions. That's good. You went over a lot there, Daryl. It's great. Oh, they would like you to send out the PowerPoint if you can.
Yes, absolutely.
Yes. If you want, you can send that to me and I can forward it over to them.
I sure will.
Yes, and Audra said, love the analogy about taking a village to raise a child. That is very true. All right, thank you. So now we will hear from Central Alabama Wellness.
Hi, everyone. My name is Lindsay Stevenson. I see a few familiar names on the call today. Specifically, shout out to Tommy. Hey, we used to work together. Also, Ashley. We didn't really work together though. I don't feel like I can do as good of a job as Daryl did because I didn't come with anything inspirational, but I'll tell you about our services. For the last 52, 53 years, we've been the Public Mental Health Center for Chilton and Shelby counties. We have, of course, MI services, but for substance use treatment services, for the longest time, we've only had level 1 outpatient, but we're applying to get a certification for level 2.1, and that would be, to my knowledge, the only level 2.1 resource in Shelby and Chilton counties. Right now, we don't have any MAT services. It's something we're kind of looking at in the future. Let me look back at my notes and see what else. Beyond substance use treatment, we have psychiatry and case management that's available to folks who are getting any kind of treatment here. Yeah, that's pretty much it. I'm short and sweet, but that's what we've got going right now. We're simple. Yes, Kendra, I work at Central Alabama Wellness. I think I thought I said that, but I'm sorry if I didn't. I'm the executive director. And what I'm going to do is I'm going to put my name and my email address in the chat so that if you want to follow up later, you can. Yeah, Kendra, it's just as likely that I didn't say it as I did say it, so no harm done for sure. I'm gonna put my email address in the chat, I forgot to mention we have adolescent substance treatment as well. We're doing level 1 and level 2.1 in Shelby County. We haven't found the need to do level 2.1 in Chilton County. But if you're aware of there being a need for that for a specific adolescent, reach out to me. I'm always looking for reasons to provide more services. So, did I spell Ella? No, don't use that email address. I forgot some of the ALs in Alabama Wellness. I wasn't here when they made up these. What is this called? Email addresses? That is way too many ALALs in one email address. Does anybody have any questions for me about us or about what's resources are in Shelby and Chilton County or anything? I know those was like very quick and dirty, but
So
What
if you had a patient or a person come in and they said that they were on heroin or fentanyl, what would you do?
we would invite them to do an assessment.
Okay, and let's say they were on heroin and fentanyl, and then where would you refer them to?
They're currently on, like they're high right now.
Well, people that typically are using they use all day, every day typically, but where would you guys refer someone that had opioid use disorder
Well,
currently?
if they needed to detox, we'd refer them to UAB. But if they have opioid use disorder and don't want to engage in medically assisted treatment, we'll put them in level 1 and level 2.1 for yeah.
Right, but so if somebody had opioid use disorder ongoing, the only place you're going to refer them to is UAB. And what about a methadone clinic? Because that's the
There's
gold
not a
standard.
lot. There's not a lot here in Shelby and Chilton counties. It's
So
really underdeveloped services in Shelby
Shelby
counties.
County has one and Chilton County has a methadone clinic,
Well, so it's Shelby County Treatment Center, right?
right? And Chilton County Treatment Center, correct?
Yeah, those are the only
Right.
places that have
So if
them.
somebody has opioid use disorder, I mean, typically you wouldn't detox them because they still have the disorder. So a patient could come directly to a methadone clinic actively using and start methadone.
Well, Susan, it sounds like
But-
you're
yeah.
concerned that I don't know enough about substance use
No,
treatment, and that's
no,
fair.
no.
I don't provide substance use
Right.
treatment.
I'm just wondering because if people come to you, I'm looking for gaps in, the stigma stuff, but I'm looking for gaps in people getting referred to the methadone clinic, like where, our speaker we just had, and what's happening in Alabama where people need direct, referrals to the methadone clinics and the methadone clinics aren't getting the referrals, I guess, because they're not, I'm not sure what's going on actually. So that's what I'm trying to figure out what you guys would do. Because UAB
Well,
sometimes
so
refers.
to answer your question,
Uh-huh.
if there's somebody who comes in and they need medication assisted treatment, we do refer them to Shelby County or Chilton County Treatment Center. We also would continue to provide therapy to them if that's what they wanted. I guess I don't really know enough, but I'm not the one providing the service. I'm just the executive director. So I'm sure if someone showed up, the substance use professionals that work for us will know, do they need to go to detox? Sounds like it doesn't. But we make the appropriate referrals when we don't have what they need for sure.
Okay, thank you.
Any other questions? Can you tell us about some of the work y'all do with the court systems? Certainly, Kendra. We work with Shelby County courts, in mental health court and drug court and domestic violence court, and then also in the probate court. And in Chilton County, we work with the probate court and the drug court for referral. And each county has their own, program for how, a judge may supplant treatment options for some punitive issue. Sorry, my lights are on a timer. and the sensor can't see me when I'm sitting at my desk. So, yes, sir, Mr. BCC Corrections. Yes, sir.
Do you also work with Veterans Treatment Court?
Yes, but that's not very robust in Shelby County right now.
Okay, thank you very much.
Yes, sir. Did that answer your question, Kendra? Okay, great. Thank you, Lynn. All right, if there aren't any other questions, thank you for listening.
Thank you, Lindsay. All right, so we will go ahead and wrap up. Thank you for joining. We hope you were able to learn something new about a resource available to you in Alabama for treatment and recovery. Please join us on February 19th for our next virtual meeting and have a great day. Thank you, everyone.